right, it's 9:02, so we will go ahead and get started. Today is October 22nd, and thank you for joining us for the NEMSIS V3 implementation call today. I am going to share the agenda here, and I'm going to pass it off to John Britt first for our stakeholder introduction.
Great. Good morning, everybody. Let me share my screen quickly. All right, so for stakeholder introduction, I've actually got both topics, so I'll go through both quickly and as one PowerPoint. Stakeholder introduction, why do we do it? To get to know others on the call and build connections that lead to collaboration. Maybe get some ideas for new hobbies or see what people like to do and spotlight somebody for 30 to 45 seconds and have some fun. But yikes, I haven't had anybody sign up to be introduced since July. So if you've not been introduced, please take a moment to scan this QR code or follow the link that I will put in chat after this so that I can introduce you. I know that there are some new data managers out there for states because I work with you. So please follow the link that I've given you or follow the link that I'll put in chat today to get that done. The next is the website review. And instead of showing an actual website, I wanted to give you an update on Tableau. So first, I'm going to just do a state report that most state data managers should be subscribed to. If you're not, follow along. Go to the very end, the very last one, which is the V3 state data submissions. And to subscribe, we used to have, well, go to the email summary. And to subscribe, there used to be a button at the very bottom that said subscribe. It was right beside watch. That button has been now incorporated into the watch button for subscriptions. And you just have to go there and then change the frequency to when data refreshes and then hit subscribe. So there's no longer gist is there's no longer a subscribe button. So if you want to subscribe to any report, any Tableau-based report, use this exact same directions. It's under the watch menu now, and then under watch subscriptions, and then always change the frequency to when data refreshes and hit subscribe, and you'll automatically be subscribed. For those of you who already have subscriptions and you've noticed that for the last few weeks you've not been getting your emails, those should be going out now. I know that I got mine this week when the data refreshed, so you should be getting them now. That was a glitch with Tableau that we have gotten corrected. And as always, if you have any questions or you need a little bit more detailed instructions, feel free to reach out to me or to put in a help desk request and somebody will help you. And that's it for me. Back to you, Lauri.
Thanks, John. And next up is Clay. Clay, do you have something to share? If not, I'll put the agenda back up.
I do. Thank you. It's a pleasure to be with folks this morning. Can you see my screen okay?
Yep, looks good.
Thank you, Lauri. We ebb closer and closer to the November 4th date when the NEMSIS TAC will implement Critical Patch 6 for version 3.5.0 and Critical Patch 2 for version 3.5.1. We're excited for that to move forward. As many folks know, I'm going to change what I share here real quick. Let me just bring up the website. We have distributed I apologize, here we go. We have distributed a survey that has been taken now by 33 states, which is great. That kind of highlights their plans for moving to CP6 under version 3.5.0. The way to get to that survey, to look at the results, and also what the receive and process software plan to do in regards to complete migration to Critical Patch 6 Down here at the bottom of the opening page, you'll see the survey results here. Just click more. It'll take you to this page and allow you to download where we are with that survey. I'll show that survey just real quick. We have 33 states, as I mentioned, that have provided data, so that'll be incredibly valuable, I think, for the vendors. You can also see what states are doing near you or the plans that they have. If you wish to kind of work together in regards to implementation of some of the changes. All of the receive and process vendors have also provided the data that we asked for. So their deployment dates, how they plan to work with states for the migration, all that is present on this Excel form. Right now, the form has, I think, 22 or 21 states listed on it. Randall and Benji are updating this by the end of the day. There'll be 33 there. There are a small group of states that haven't submitted the survey yet. It will only take about 5 minutes to complete at most if you're a state that's on this list. If Randall would be so kind as to place the link to the survey in the chat, you'll be able to complete it, and it won't take long at all to do. That was one item that I wanted to cover. The other item I was hoping to cover was just to let you know, if I go back, see if I can go back to the website here real quickly. As folks know, we've been working on modifying this when changes will take place, a document that everybody depends on so much. We are kind of disencoupling two purposes. One purpose was just to define what modifications to the NEMSIS standard look like, what versioning looks like, what is a minor versus a major, and then also providing a roadmap for moving from 3.5.0 to 3.5.1. We are working now hard on the new visualization. See if I can show that. The new visualization that shows the relationship between major and minor releases. We have some touch-ups to do on this, but this will be available on the website probably beginning next week. And then during the second half of October, beginning of November, we will be working with you, our stakeholders, to define a process for more clearly delineating where we are with version 3.5.0, what we're expecting for 3.5.1 and then into the future. So we will work on that timing together. Any questions in relation to the survey for states, their movement to critical patches, or where we stand with versioning of NEMSIS? Any questions? All right, I'll turn it back over to you, Lauri.
Okay, sounds good. Thanks, Clay. And we will watch the Q&A, but I haven't seen any questions come in yet. Next topic is Chris Hoffman, who's going to share our new annual report state template. So I'll pass it over to you, Chris.
Perfect. Thank you, Lauri. Excuse me. So I'm going to share my screen here to give a kind of a tour to the website where the page is. Lauri, can you see the website okay here?
Yes, looks good.
Perfect. Okay, so like Lauri was saying, we've been working on a state data manager annual report template for a little while now. This is really exciting to be able to get to release this and have people be able to use it, get us some great feedback on this. So let me show you where it is first, and then we'll talk about what it is. So if you go to the main NEMSIS website, and then go to using EMS data and then the NEMSIS 101 section. We have a space in here under NEMSIS 101 that is called state-specific tools, which say that 3 times fast. And down here, the very bottom one in that section, the State Data Manager Annual Report template is right here. And so as a matter of fact, and you know what, I'm going to stop the share real quick and start again, because when you show a video, you have to do it in a particular way and say share the sound and optimize the video for video sharing. We'll do that one more time here, and I've got a YouTube video here that gives a quick tour of the template. So let me know right away if you cannot hear this. In this video, we'll walk you through how to use the NEMSIS Annual Report PowerPoint template designed specifically for state EMS data managers. This template helps you compare your state's EMS data to national benchmarks provided by NEMSIS. The template includes sections like an introduction to NEMSIS, information about the National Data Standard, the total number of activations, demographics, EMS response characteristics, clinical data, the NEMSQA performance measures, and the NEMSIS motor vehicle crash dashboard. Most slides show NEMSIS national data on the left, with a space on the right for you to add your state's data. You can type in numbers, paste charts, or insert images using placeholders. Feel free to use only the slides that are relevant to your report. You can remove, rearrange, or customize any slide to suit your needs. Once your report is complete, you can export it in multiple formats: PDF, Word document via PDF export, images, or as a PowerPoint show for easy presentation. If you're ready to get started, download the template using the link in the video description. So that's the State Data Manager Annual Report template, a quick walkthrough. When you click on that link, you'll be taken to a Google Drive. It is a fairly large PowerPoint because it has a lot of images in it. So when you're brought to that page, if you want to download a version for yourself, you click on File, and then there is this download as a PowerPoint, and then you will be given a version of it that you can have in PowerPoint. Again, this can be, use all of these slides, use one of the slides. This is for you to help create a new help ease making an annual report. You can see here in ones where there's numbers, there's a number on the left that has the national numbers, and then a space on the right for you to be able to put state numbers. On ones where there's a chart, there will be an option here where you can click and insert your own automatically insert your own chart. We did show this template to a select group of data managers, and we got some feedback here asking what the inclusion criteria is for the charts on this template. We are working on a succinct definition of what the inclusion criteria is on here, so that you make sure that when you're putting data in here, you are comparing apples to apples. And so that will be added to this. It's an online version of the, since this is cloud-based, it's real easy to add that. We'll have that added to the template in the next couple of days. But that is available now. It's on the website. If you would, when you have a chance, go ahead and download, and then send any feedback that you have. If you go to the NEMSIS website, at the very bottom of every page on the website, there's a button that says open a help desk ticket. If you'd open up a help desk ticket in there with your suggestions or questions and any sort of screenshots that would be helpful, that would be great for moving this forward. And then obviously we're planning on updating this every year when we update the NEMSIS annual report. So thanks for the time. I sure appreciate the help and the feedback so far, and happy to hand it right back to you, Lauri.
Sounds good. Thanks, Chris. And one thing to point out there too, in case that's not obvious, that underneath the title there's a word in blue. So the name of the element, there's actually a link there that'll take you to the data dictionary and describe it a little bit more. And I know we have had a request as well of this is a great first step, and it would be great if eventually we could have perhaps a dashboard where you could really run your own state's information and download that easily, or have some sort of a report that we produced and made for you. And so we've put that on the wish list for down the road as well. We'd love to be able to offer that in the future, but I think this was a good first step towards that. So thank you, Chris, for all your work with that. And I'm going to pass it over to Randall next. Randall, do you have anything to share? If not, I can put the agenda up. But Randall has a NASEMSO liaison update, and then also violence against EMS update, and then national custom elements. So you have the next three topics, Randall.
I do have a screen to share. You should be seeing a PowerPoint with like a NASEMSO logo. Is that what you're seeing?
Yep, we see it. It looks good.
Let's see if I get the rest of the buttons here. All right. So first slide here is just the DMC vision statement. So NASEMSO has vision statements for each one of their councils and committees. We decided we needed to kind of beef ours up because it didn't really highlight all the work that we do. So the new slogan that was approved yesterday at the DMC meeting is to lead the nation in the advancement of high quality, actionable EMS and public health data by fostering collaboration, innovation, and standardization across states and territories. The DMC envisions a future where real-time, reliable data empowers informed decisions, improves data outcomes, and strengthens emergency systems at every level of care. So that's the new vision statement for the data managers. Gone through quite a little process to get that completed, and I'm happy to announce it's completed. Next, we have just some guidance documents that we've been working on. 1 second and move this item. There we go. The first one here is the AI use in EMS. The guidance document outlines the benefits, risk, and critical consideration the EMS leaders must evaluate to ensure responsible, secure, and ethical use of AI technologies within their operations. This document had a few minor edits yesterday during the business meeting. We're also going to be looking for some consistency with the wording of like EMS clinician versus EMS personnel, just making sure it's very consistent. And that document's actually moving for some final edits. After the DMC completes these documents and we've gone through the working meeting and all the discussion, we give it over to a member at NASEMSO just to sort of like a third look at it, to sort of format it, give us some of the commas, make sure we're spelling everything out appropriately. As long as there's no major edits, this document will be moving for board approval at NASEMSO. Another document that they had been working on, which is moving for some board approval, which is the requesting EMS data across states. And it really offers the essential guidance to help navigate the state EMS data requests responsibly and efficiently. So this is just to help all the researchers who are making the data requests to the states. We are still working on a blood transfusion guidance document, sort of our version 2. It's a pretty large document at this point, needs some extra look on it. So we've moved that to our working meeting agenda, and hopefully we'll have some more updates on that very soon. Next here we have update on extended data definitions. So 2 new field values were added for 3.5.1 for the alcohol and drug use indicators. They are bystander family reports alcohol use and bystander or family reports the drug use. So very similar to the extended data definitions wording that we have now, but basically just sort of updating the fact that it's the bystander reporting and under the influence of alcohol or under the influence of drugs. Next topic I have here is about some national custom elements. These have also been moved to our working meeting. Yesterday's DMC business meeting was jam-packed agenda. But it's the blood facility identification number, which is a unique identifier for tracking of the blood donations. There's also a new element for date, time the medication was stopped. Basically, what time did that medication stop? And then we have a kind of based off of that medication stop data element. There was a third one that was sort of created here for the medication status at the time of transfer, and it's really the status of the medication for the administration. And then we have a list here of field values. So once these are approved at the DMC working meeting, which is October 28th, we'll have an update for those and we'll get those moving. We had a really good discussion about the fine list. And this was specific to the micromobility We are going to be reaching out to our trauma managers council at NASEMSO to see if they have any suggestions or newer codes. So these are the two current codes we have on the defined list around micromobility. So there'll just be a little bit of work here to see if we can update those. There was some conversations about segways or other devices. So we're just going to be, like I said, reaching out to the Trauma Managers Council, see what they suggest, and we will be updating everyone when we have a better answer. Another thing I just wanted to sort of highlight the state spotlight that we've been doing at our NASEMSO Data Manager Council meetings is this Tell Me Something Good. This has been a really good idea or really good opportunity for some of our states to show up with some of their data efforts on quality. Sometimes they show us about their times they do or different links that they incorporate within their systems that will really help the states. So far we've had 3 presentations by Kansas, Wyoming, and Oregon. It started up a really good conversation between the members. And I think we look forward to that kind of ending the Data Managers Council meeting every month. So that's all I have for the NASEMSO update. Was there any questions about the NASEMSO update before I move on? All right. So the next topic here is the violence against EMS clinicians. A lot of discussion about this. I know that we've all really seen the data elements. We have all kind of gone through the surveys. Just a quick reminder for everyone, just like a quick timeline. This was a large effort that we went through to kind of collect this information. I always call them the team from Canada, but it is Dr. Donnelly and Dr. Moz. They did a great effort of kind of explaining their system to us and helping us identify some stuff. We also use a SAVER system, which is through Drexel University, which they have like a violent reporting form, where we're able to really kind of look at some of those data elements. We worked with our software vendors. There was a working group with United States Fire Administration, CDC, NAEMT. There was NEMSIS members, NASEMSO members who were on that, some of the software vendors, and we even had EMS clinicians to sort of help us with these data elements. And then at the NASEMSO level, the state EMS directors, they see it, they love it, they're excited for it. Data managers, they've seen it, they've taken a survey and adjusted some stuff. And our NASEMSO medical directors are actually looking forward to this as well. So we're sort of finalizing these data elements. Here, I'm sorry, for E-Other 06, we have already added these violence field values. This would be for version 3.5.1. So you'd have these areas to select. We did work with the entire NEMSIS working group to get these done. Page, Wolfberg, and Worth were also involved, kind of review these words, making sure they didn't intersect with any state laws and have different meanings. So there was a lot of effort to put these values in here for E-Other 06. And so with this form, we do kind of have 5 major sections of it. There's the EMS crew member details, there's the event details, law enforcement report, supervisor's report, and then there's some additional elements around like flagging for dispatch, or maybe possibly pulling over like some of the impression fields of what was going on with the patient. So some further discussion on this was really kind of around the EMS crew member details and the event details. So these are going to be moved. These data elements will be selected for national custom elements. We'll be working with the Data Managers Council to get these created. Just to kind of highlight and to remind everyone, these 2 sections, they have quite a few data elements, but some of them are existing NEMSIS data elements. And so they're already in the system. They're just part of it, but there are a few new existing elements that we would create. I would be looking for some additional guidance with these national custom data elements, working with our state EMS directors, our legal teams, and making sure that these questions are okay. Because they are national custom elements at this time, they will be on the EPCR form. And one of the considerations you'll want to have is making sure they're not present when you print that form out for like the hospital or handing that form out. So once those are created, we'll continue to work with everyone. And also we'd like to have a lot of feedback on those data elements. Any questions on the violence?
We do have one question, Randall. I think this was actually from your previous talk, but David Saylor is interested in seeing or reviewing the blood custom elements a draft of that. Is that available for review?
I mean, they're not necessarily available for review. I mean, if I were to send those out, they could change in the working meetings. And that's actually what's happened with a few of the data elements, and that's why they've been delayed as we've presented them to our data managers. They found, better ways to implement them. So we're more than happy to share the draft, but I wouldn't say that they're final until next week.
Okay, sounds good. Thank you. Any other questions for Randall related to violence or anything else? All right, and you've got the next topic as well. Is that right, Randall?
And I don't have any slides prepared for this. I think that was just going to have like an open discussion about it. And then, of course, Clay, if I miss anything, please feel free to add it. But during the NHTSA annual meeting, there was a discussion about the national custom elements, what to do with them, how to create them, or move them into the standard. So that list is pretty long at this point. There's about 40 of them. I kind of showed some of the members at the NEMSIS TAC. Kind of a breakdown of all those elements between the field values and the complete data elements. We sort of put them into different categories of like their value or their use. And so I do believe we're trying to clean up that national custom data element website a little bit, kind of put them into different categories, and then really start to decide that movement process into the standard for those elements that are needed. I know the big discussion right now is around like the blood data elements and making sure that those are being used. And so also with national custom elements, we did hear that there wasn't a lot of use of them. And so we were going to start trying to do a better effort moving it from that NASEMSO national custom element side back to like our NASEMSO members, our medical directors and state directors, just to make sure that they're still aware if they start a new program to use those data elements, that those are the elements that they start with. Anything I missed there, Clay?
Yeah, no, great summary, Randall. Yeah, we're moving forward with the idea that I think we as stakeholders all agreed upon, the idea that national custom elements could be used as a way for elements that we think will move into the national standard, a way for them to be available quickly, and where states could pilot them and make sure that they're developed correctly before they end up in the national standard. So the idea is, yeah, with the modules we put together, CPMIH, violence against EMS providers, that those will end up being quote modules in the National Custom Element Library, and will be available for use as soon as we finalize them. Again, with the idea that states will be able to utilize them and hopefully kind of pilot test them before they move into modules with the next major revision of NEMSIS. So we'll do our best to organize that, and states, if there are national elements that that we're trying to pilot across the country, we'd like you to seriously consider including them into your state system. Thanks, Randall.
All right, thanks for that additional input, Clay. And that's my updates for today, Lauri. Any other questions for me?
Nope. David said that a draft is fine, so I let him know we'll get him a draft of that blood custom elements to review. If anyone else is interested in that, just put your name and blood draft, you can say, in Q&A there, and we can get you a copy of that as well. Any other questions for Randall? All right, we will move into kind of our open Q&A session in just a minute. Jeremy Kinsman is on the agenda, but he's not able to join us today. So just some quick announcements. Coming up November 4th is our next public training. So be watching your email for details and a meeting invite for that. We will have just one V3 call in November. So Wednesday, November 12th, we will have a V3 call. We will not have it the week of Thanksgiving, recognizing a lot of people are off on that day or out of office on that Wednesday. So just one V3 call in November. And it's time for our open forum. So if anyone has questions, feel free to put it in chat and we can unmute you if you would like to ask it live as well. Any topics to discuss, questions to ask? All right, I don't see anything yet, so I will pass it to Amanda Pope next, who's going to give us some instructions on our breakout rooms.
Hey, okay, there we go. Sorry about that, everyone. Good morning. Just a quick reminder, vendors, please only go into your assigned breakout rooms, and everybody be respectful.
That's great. And you should see a option pop up if you can click in to the room you'd like to join if you have any questions. Thanks, everyone. Thanks for joining. Good to see you today.